Against the current president.
Leonard, who joins us this morning. Morning, Rosemary. Are you surprised by these findings?
No, I've seen it happen.
Have you?
I've actually seen it happen. In the times I've been a GP, I've had at least 3 instances where a spouse has died within a few days of their husband or wife. And there has been a lot of talk within the medical press of dying of a broken heart, and it's been thought in the past to have been due to damage to the heart muscle, and this is showing that actually people genuinely do have heart attacks and are at a hugely increased risk of a heart attack straight after someone's died.
But Rosemary, it is not the case that this happens out of the blue. This is people who already have a predisposition to a possible heart attack. I mean, it's not literally, they're not healthy one moment, and then the bereavement happens and the next day they're in danger. Is that right?
Yeah, the risk of having a heart attack is greatest in people who have an underlying heart condition who would be more at risk of having a heart attack. But you can get heart damage in people who are previously healthy, particularly in women in their 50s and 60s. There is a condition where the heart is damaged by the stress induced by a sudden bereavement, or just the stress of a bereavement, even if it's expected. And it's due to the blood pressure goes up, your pulse rate goes up, your stress hormones go up as well. And there's another issue, particularly with elderly people, that they may not eat properly, they may not drink properly, become dehydrated, and they may forget to take their regular medication. So there really is a role for GPs and actually for other younger relatives, if you've had somebody elderly die, to look after the remaining spouse and say, look, you've really got to look after yourself. And interestingly, there may be a case for saying, if a long loved one has just died, there may be a case for saying, take an aspirin. An aspirin is also in the news today because...
Well, it is, yeah. An aspirin a day risks more harm than good, it seems to be suggesting now. Experts had called for people over the age of 45 to have an aspirin a day, and now there's a suggestion that you shouldn't. Why not?
I mean, this is one of these stories that's been coming in, take an aspirin, don't take an aspirin. The main problem with aspirin is the increased risk of stomach ulcers. And this has been a big study looking at other studies, a meta-analysis as it's called, and they found quite conclusively that in people who haven't got heart disease, the risk of taking aspirin, the risks of it, and particularly stomach ulcers, greatly outweighs any benefit. I mean, in fact, doctors have been following this advice now for several years, and we don't use aspirin for what's called primary preventions. That is, people who've never had a heart attack, never had a stroke. We don't use aspirin in those people. We're only using aspirin in people who've already had heart problems, already had strokes, who we know are at increased risk.
All right, that's very useful advice. Thanks, Rosemary. Dr. Rosemary Leonard.